2, 1, live.
All right. Good morning. Recognizing a quorum of commissioners, I'll call the October 7th, 2024 meeting of the Cannabis Control Commission to order. This meeting is being held hybrid pursuant to Chapter 22 of the Acts of 2022 and is being recorded. Commissioners Camargo, Commissioner Roy, and myself are participating in today's meeting. All votes taken today will be by roll call. I will generally summarize our agenda. We will start with the public hearing regarding the delivery licenses, micro-business licenses, and telehealth certifications for qualifying patients, regulatory amendments, which were published in the Secretary of the Commonwealth's Register on September 13th, 2024. I will ask the commissioners wishing to comment or ask questions during any part of the meeting to please raise their hand to be recognized. Okay. All right. For those wishing to testify, please add your name to the sign-up sheet in the back. We will take testimony in the order that folks signed in. If there are any elected officials who are here who wish to testify, they may go first, but unless Devin's done something different with his career, I don't see any folks, any elected officials in the audience this morning. All right, first we will hear testimony from those who are in person before moving on to those who will testify virtually. Please be advised, and we're switching from in-person to virtual testimony. I will request a brief recess. In order to allow as many folks as possible to testify, we will be limiting testimony to 3 minutes, received by our new clock. Speakers may be asked follow-up questions at the discretion of the commissioners. The commission asks that speakers use respectful language, and the commission encourages speakers to submit their testimony in writing as well. For those who cannot attend this public meeting in person, written testimony regarding the delivery licenses, micro-business licenses, and telehealth certifications for qualifying patients, regulatory amendments may be submitted to commission@cccmass.com with the subject line regulatory amendment testimony by close of business today at 5 p.m. Question? Oh, just scratch. Okay. All right. All right. We will begin. I invite the speaker to please come up to the podium. We will have our clock start, but please introduce yourself, anything you want us to know about you, and then your testimony. We'll start with Devin Alexander.
Good morning. My name is Devin Alexander. I'm a lifelong resident of Quincy, Massachusetts, one of the designated areas that's been disproportionately impacted by the war on drugs. I am a graduate of the first cohort of the State Social Equity Program. I'm also the CEO and co-founder of Rolling Relief, a marijuana delivery operator based in Newton, Massachusetts, that became the city of Newton's first social equity licensee to commence operations. I've known you all for a long time. It's been a long time coming. It's been a long time to get to this point. This is something myself and countless other people have been advocating for since summer of 2020. 4 years. I started that when I was, about to turn 27. I'm 31 now. That's like a whole high school experience, 4 years, just talking about the same thing over and over again. And I've become known as the two-driver guy to a lot of people in this state and other states when I travel across the country. That's what people know me as, because we've been talking about this for so long. Nothing I can tell you today is something that you haven't already heard. Over all this time, I've developed a relationship with all of you over the years since you all came here in 2021. We've been on news segments together. We've been, on rallies together. And it's been a long time coming. And I'm just really ready to move on from this. I'm sure you all are too. There's so much more other topics that need to be addressed to move the industry forward. But these ones today, they do just that, right? They move the industry forward. We've been seeing as a model for some, right? When we have this exclusive window for equity applicants, we have seen other states adopt that model as well. And to me, the crown jewel of the equity program was the exclusive window to run this. But how could you give an exclusive window for something that was, let's say, not profitable, to put it lightly? We helped create the delivery operator model in 2020, because before there wasn't even an option to wholesale. There was countless stakeholders that were against that. They didn't want us to have our own independence. They even wanted so far as to file a lawsuit against the commission back in 2021 over the creation of this license. But due to public pressure, public awareness, they dropped that lawsuit in less than a week. And we still had to wait for that license to come out. And we still had to teach these municipalities just what delivery is. What are we doing? What does it mean? How is it not going to affect your daily life? As I just want to say, as my time draws near, I thank you so much. Finally getting to this point, the ability to have one driver will help delivery companies all across the state, and it'll be a model for other states to follow, which a lot already do, as you already know. A lot of other states already have one driver, so we're really the one playing catch up here in terms of that. So couple that with the future disbursement of the social equity trust funds. This is something we've been dreaming about. For this both to happen at the same time and to come, it's going to be a huge boost for equity applicants and delivery licensees all across. Thank you for allowing us to repackage as well and allowing us the ability to go until 11 p.m. Previously, we were only allowed to stay till 9 p.m. Being allowed to stay up until 11 p.m. is going to be crucial and it's going to be vital. I see my time is drawn. And once again, thank you so much for all your hard work. Let's speed this up. Let's get this voted on this Thursday. Let's get it stuck at the Commonwealth. Let's get it promulgated and let's move on. Thank you.
Any questions?
Well, I'll just say, Devin, your advocacy is bearing fruit, and I know you guys really worked hard, all of you in the delivery space, to see this come to fruition. So that we're the next step towards getting over the finish line. So, your advocacy did not go unnoticed, and like you said, you're recognized nationwide now as the would you say?
The true driver guy.
The true driver guy. Thank you, Devin, for all your advocacy.
Thanks, Devin. Appreciate it. Christopher Feverick. Chris here? Yeah. Okay. Ryan Dominguez.
Morning, Commissioners.
Good morning.
Chair, staff of the CCC. I'm Ryan Dominguez. I'm the Executive Director for the Massachusetts Cannabis Coalition. On behalf of our 70+ members, we want to say thank you first for all of your work on putting together these regulation changes, as well as for hosting this hearing today. I know some of you have probably heard from my members regarding the 2-driver rule, but I just want to reinforce that we support all of the changes that are put forth before you today, including the amendments to micro business delivery and telehealth. However, as you'll see in more detail in our official comment letter, the MCC is requesting that the Commission implement the 2-driver rule change for all business-to-business deliveries, and also request that the Commission create some consistency within the manifest section of the regulations to allow for a recounting option in addition to reweighing upon receipt of deliveries. I'll focus my comments today on the 2-driver rule, as this can have a really major positive financial impact on our industry. If the Commission were just to mirror the same language changes that is implementing for deliveries to consumers and apply them to the business-to-business deliveries within the marijuana transport section of the regulations, you can help all licensees in a time when the whole industry is struggling. So this includes our independent testing labs that are transporting very small amounts of cannabis, as well as our independent product manufacturers who have limited resources and have to use that second driver when it's not actually making deliveries that are business to business any more safe. At the MCC, we collected delivery data from a member of each of our license types, and found that in over 20,000 deliveries from a period of 2020 to 2024, there were no incidents of theft, diversion, or robbery with business-to-business deliveries, and to specifically talk about product deliveries. The only incidents involving these deliveries had to do with vehicle failures, including a flat tire or some type of engine trouble. So we already have some of the most strict delivery laws across the country. And so I want to use the rest of my time to kind of just paint the picture for where we're at as the industry. We have a lot of states that are coming online with their own state regulated cannabis. They're changing their regulations to kind of undercut Massachusetts. And a lot of our businesses are struggling after putting their life savings into trying to build a new business, and they're potentially going to go out of business. So I think at this time, we have an opportunity to kind of show the industry that we can make changes for them that will really impact their bottom line. I think for us, as we've been going through this process, and I think Devin just talked about it, we've been talking about the 2-driver rule since 2020, before my time in cannabis policy. And a lot of the time, now that we've, kind of getting to this finish line of implementing, there's people who feel left out. And then for those licensees specifically, they're asking us to go to the legislature. And when we go to the legislature, they respond back to us and say, hey, isn't this a regulatory change? Why can't we get this changed through the CCC? And our response to them is that we have good communication with the CCC. The commissioners are showing up, having meetings with us, taking site visits. But at the end of the day, we're still waiting for some of these changes to happen. And so I think right now we have an opportunity to implement a change that we all believe is within the scope of the things that you guys are working on today. And so we hope that you can make that 2-driver rule change within this regulatory round. And hopefully, like Devin also said, there's a host of other issues that delivery drivers, as well as all these other licensees, are facing. Things like agent registration cards and some of the other things that we can all agree upon. So I hope that we can show the industry that we can make that change, and we can have a more comprehensive package that will come out very soon, because I think it's much needed right now. Thank you.
Good question. Commissioner Roy.
Thank you, Ryan. And 2 points I just want to go back and reflect on. So you talked about the inventory counts. Can you please share a little more your thoughts around that?
Yes. So currently, with the count option that you've all created, it allows for the folks who are creating the delivery, so like the first stop, to do counting in addition to weighing. But when they actually deliver it to the retail location, that change hadn't been made within the regulation. So it's just a simple adding of the recount to those sections. And in our letter, we show you exactly where you can place that into there. And I think, the biggest issue for licensees right now is that when they're going and having an inspector at their location, it's really hard for their cameras to bring or zoom in and get a clear picture of like the weigh scale. And in that sense, they'll receive a notice of deficiency. So we can remove some of these notices of deficiency that are kind of irrelevant because of a camera, rather than having something like a count, which is just as accurate in terms of counting how much product is going out. So it's just creating some consistency within the regulations there.
Thank you, Ryan. And then my second question is around the B2B.
Yes.
And we've gotten some emails saying contrary to what you're saying, but
Okay.
So, and I hear you with the B2B, because I have met with third-party transporters as well. And they could still have the option they say, give us the option to have 2, but if we want to go to 1, and I think that's kind of what you're saying too.
Yes.
And, okay, because what I'm hearing from third-party transporters is that there is an uneven playing field with someone, an ME with a DE. So an ME with a delivery endorsement will now be able to go to, sounds like 1 driver, and they feel like there's an level playing field if it's a marijuana establishment with a delivery endorsement to B2B. So you're advocating for the ITLs, just so I understand.
Yeah, ITL and yeah,
a third-party transporter
exactly.
to be able to enjoy the same regulation, the 2-to-1 driver rule. That's what you're saying.
Exactly. And again, it's an option. I think I've also spoken to delivery to consumer operators who say, for me, like, I would like to have the second driver there. Maybe it creates a sense of security. But again, I don't think that the data that we have shows that it creates any additional safety there. But yes, just having the option for those businesses, I think will go a long way.
Okay. And Acting Chair Stebbins,
Mhm.
I don't know if we need a legal opinion if that falls within the scope.
I mean, what we're doing today is taking testimony for our
Yeah.
legal team to go back and review before we look.
But I mean, adding the ITLs and the third-party transporters, I
They'll
don't need a
also-
legal opinion whether that,
They'll
all
also
with-
be looking at that. So
Yeah,
that's what
okay.
we discussed.
okay, awesome.
Perfect.
Thank you.
Thanks, Ryan.
Thank you.
All right. Next up is Chris Sawacki.
You want water?
Chris?
You're stuck on the highway.
We'll go to DB Burbo. Devin, I'm sorry.
How does this work? I've never been here before.
Well, as soon as you start speaking, the clock will start at 3 minutes.
Okay, my name is Debbie Campanella Verbo. I'm a lifelong resident of Massachusetts. Matter of fact, born and raised in Worcester. I'm actually one of the people that helped the representatives go into my house to make most of it legal. And we discussed a lot of things. One is a medical marijuana program. I'm an original medical marijuana program from the original restrictions. Some of them need to be changed, but I think the program that runs right now is stupid, to be a simple word. I can walk up and say, I picked my nose the wrong way, and you're going to give me a medical card. Where people with real medical issues, these providers don't even know what they're talking about. I'm in the fight with one of the providers because she's telling me that what I'm telling her is garbage. And I said, how does your 6-week stint master the National Institute of Health? And she told me to prove it. Otherwise, she was going to have an issue with me. I think the program's crazy. I think medical marijuana is supposed to be treated as medical marijuana. We have people who can come up with their own packaging, and sorry to say, the cannabis is trash as far as medical is, but we pump it on the medical side. Why? Because we don't want to create a rift with that company. That's not how medical marijuana should run. Okay, there should be stricter certification laws. There should be, like for myself, I'm a medical marijuana patient because I'm a bipolar 1. And since COVID, I can no longer get my medication. So I use terpenes to supplement what it can through the help of my primary and my psychiatrist. Okay. But I have your providers telling us we don't know what we're talking about, but they have me listed as a cancer patient. If the paperwork that I proceed to give you says that I'm a mental health patient, but my underlying diagnosis is cancer, why are you choosing what is my medical problem? And why are you arguing with me about it? And why did you people change the law? It used to be we went to you for an allotment. The first time in all these years that I've ever been a patient, I asked for an allotment, and she told me I was a junkie. I mean, is this how you want the program to be run? She told me if I didn't like it to go find another provider, and all that for $50. She showed up 15 minutes late and copped an attitude with me. I don't understand your program rules. Before, you were a little too strict because insurance companies do not allow your doctors to give you a note saying, I allow my patient to smoke pot or to partake of it, but they can write you letters saying, my patient does communicate with me and we understand what's happening. You don't even have that anymore. I mean, I don't understand the program. I just don't understand the program. The rules for a provider. I mean, I should be a provider with the way these people talk. I mean, I have a 16-page thing to fax to this woman because she tells me if I don't like what she has to say, I should bring my doctor in there and I should bring my psychiatrist with me. And then proceeded to stare me down. And I asked her what her issue was. And it's gotten to the point where your providers and your, not just medical providers, but your cannabis providers feel above us. And I'm not sure why, because if you don't have a medical patient, you don't have a medical program. There's a few brands out there that are local that I've tried and I've asked a million people. Everywhere I go, I'll say, have you tried this? Yeah, it's a hit or miss. Then why is it on the medical side for sale? Shouldn't there be stricter ramification, clarifications as to the terpenes because this is what we're looking for. Patients who are real patients, not somebody dodging the tax bullet around Massachusetts, knows that you don't care about your THC level. You're caring about how your terpenes are affecting your life and your mentality or your physicality or something. There's a lot of misinformation out there that I don't know if you help promote it, but it doesn't cure any cancers. I'm sorry, I'm a cancer patient, and that's not true. In some instances, it does stunt the tumor, the tumor, but that's very specific types of cancer. So, to brag about those when it's really a million other we're mostly dealing with seems, I don't know, your program, the stricter rules were better last time, not as strict. Like I said, you went to, degrees where, like I said, you have the government controlling what doctors can say and don't say. So that was a little too strict, but you've got it now. They don't even read your paperwork. I mean, I feel insufficient. Before, I used to grow my own. I didn't need a medical card, but when I got diagnosed and I had cancer, I became unable to metabolize. So therefore, I have to have my own medicine compounded. Well, that is on the vagueness of the pharmaceutical company releasing that raw product. At this point in time, I've been 4 years without the correct medication. So my therapist and I have been dealing with the medical marijuana program to supplement that while we get more, medicine. That's why I think this is a big problem. And I don't think anybody says anything. When I do, I get told I'm a big mouth. Like I go around and complain to all of them. I'm like, why are you selling this? It's trash. What does this do to you? Do you get high? No. What do you expect me to do? I'm not going to feel nothing. If it can't get you high, it can't get no terpenes. I mean, there has to be some. Who cares what my relationship with you is on the medical side if I'm selling for you on the recreational side? Does that make sense? I know I'm a little nervous and loquacious because of my mental illness, but I'm trying to get my point across. I apologize.
We appreciate you coming forward.
Do you have any questions for me?
Any questions? for you? You
It's
want-
on the product side, Debbie, you're saying it's not.
I think there should be a certain type of quality for the medical side. Like most people who have medical issues, whether they be physical or mental, use terpenes, not the percentage of your THC to get relief. So I think there needs to be better quality. So if, Bruce here has a better quality than Kimberly, why are we still toting Kimberly's on the medical side? Because we don't want Kimberly to be mad at us. That was the answer I got. We don't want to ruin our relationship. I said, well, that's stupid because your relationship's still there. You just explained to the person, in all honesty, this is not going to work on a marijuana side, the medical side, because you're not producing enough of what we need. But on the, the recreational side, it can sell. So how's that ruining your relationship? I think your program has forgotten about the patient and is concerned more about profitability for everybody who is concerned. That's how I feel about the program.
Thank you, Doug.
Thank you.
Are those your comments? Can we?
This is what I wrote, but I probably didn't follow it if you wanted.
That's okay. We'd be happy to take it.
You don't have
Be happy to take it. Thanks.
Sorry.
Appreciate it. No, don't apologize.
No, so you leave your choice. Yeah, you could stay, listen to everybody else. Thank you for coming. You've been the first time. Thank you for the testimony and for sharing. And don't apologize.
Nice job. Next up on the list is Alfredo Johnson. Okay. Ruben Sight. Ruben here? There he is. Hi, Ruben. Good morning.
All right, do I just start? Oh, there we go.
Great.
All right. Good morning, everyone.
I need to reset the clock.
Okay.
All right, go ahead. Start and the clock will catch.
Okay. Good morning, everyone, commissioners. I really appreciate you taking the time. The clock isn't going.
It's okay.
Oh, no, there we go. Okay. I really appreciate you taking the time to create this this hearing where we're able to share our feedback on this current amendment of the regulations. I'm Ruben Sadie. I'm one of the owners of Delivered Inc. I am also a graduate of the first social equity cohort. I'm here to express my support for removing the 2-agent rule, for allowing home delivery operators to repackage wholesale cannabis, for the expansion of the delivery hours we're allowed to be delivering, and for the expansion of, or potential expansion of micro businesses with the changes you're doing there. But I also want to take a second to urge you, to really urge you to consider extending the exclusivity period for the home delivery license. It really, like Devin emphasized earlier, it's taken the entire 4 years, 3 years that this license has been alive to finally get to the point where we might become profitable. And even then, you know, it's still a very competitive market. There's still a lot more at hand than just this whole 2-driver situation. So even with these changes, it's still going to be, all of us are still going to be out here fighting. And if that fight happens while the delivery license gets opened up to the general public, a lot of us don't have a chance, quite frankly. We don't have the budgets, we don't have the connections, we don't have the resources that a lot of these other entities do. Entities that are dying to get into this space because they see the opportunities that we've unfortunately haven't been able to access due to the restrictions in place. So I really would urge you to consider expanding the exclusivity period for a minimum of 3 to 4 years. In addition, I would urge you to consider allowing delivery companies to go to no towns and hotels. It is a complete lack of care for these consumers that live in a no town or for some reason or another find themselves in hotels. A lot of these people are medical patients. They have their own disabilities. They have their own reasons that they're stuck in a hotel or in a no town in the first place. So who are we as the business to tell them that you can't access your medicine because our laws don't allow us to deliver to you? And this is a complaint that I hear often. As the owner of the business, I'm also very involved in the operations. Every week we get customers trying to place orders in no towns, in hotels, and especially a lot of these people are medical patients that do not have access to home delivery in our neck of the woods. And even medical delivery, just people aren't doing it where we are. So we are really the only option for a lot of patients and consumers in central Massachusetts, and removing these strict regulations would really help both create more access to consumers so they don't have to go to the illicit market, but it would also give us a better opportunity to become a profitable business. Thank you.
Any questions for Ruben?
Okay, where is your business located?
Clinton.
Okay, so most of your,
Deliveries are right here.
oh, gotcha.
Yeah, in town. Yeah. Yep. Oh,
Thanks for,
thank you.
appreciate it. Next up is Brandon Pollock. Hi, good morning, Brandon.
Morning. Happy Monday. So yeah, thank you for having me. Brandon Pollock, CEO of Theory Wellness. We've been starting the medical program, adult use now as well. We have 4 dispensaries. We also operate in a few other regional markets here. I think, you know, from our perspective, we appreciate the red lines to the regs. There's a lot more opportunity out there that I hope we can get into in the next, quarter or two. We're competing against other markets now. New York has over 200 regulated dispensaries and a whole lot more unregulated. Connecticut's growing. Rhode Island's about to issue more retail. Vermont's mature. Maine is mature. So besides New Hampshire, we are competing against other states. And I think we need to keep that in mind in looking at the whole competitive landscape out there, because it's pretty bad. A lot of small entrepreneurs are barely making it. There's a lot of bad actors in the state right now that are not paying their bills, that are putting people in a hard spot. We have a lot of oversupply, a lot of opportunity on testing. Testing is essentially a carryover, sort of rebranded process from the DPH days. We have a lot of, especially on what we're actually testing for, a lot of opportunity there. Agent cards, probably a $5 million a year inefficiency. So there's a lot to go over in the future, but just to stay on track for the red lines here, my essential testimony is, first of all, everything is good, all good proposals. Certainly delivery folks, you know, you don't need an extra passenger sitting there. Telehealth makes sense. Similar to what Ryan was advocating for, we would just appreciate the opportunity to allow you to consider removing the forced passenger for all transport. It's hard for me to think that delivering to a consumer is less risky than a business-to-business transfer with secure CCC licensed facilities. Not that I think it's risky at all going to somebody's house, but to think that going from a cultivation to a lab is more risky and therefore requires two people, I don't buy it. I think you could show the industry a small, but I think meaningful from a philosophical perspective, that you guys can get some stuff done and listen to what's going on out there and make changes that benefit everybody, including the employees. This is not a professional career path sitting in a car with nothing to do. Like, that is not a career path we want to put anybody on. They're not going to stop a robbery. It's just not useful. In Vermont and Maine, where we operate, you only need one driver. It's just fine. So anyway, just wanted to, you guys consider that, please, and thank you for your consideration and time.
Thank you.
Thank you so much.
Yep.
Thanks, Brett.
Appreciate it.
That is all the folks that we had signed up for in person. We have more?
Shut
Oh,
How's it going?
hey,
Got coffee? I got
just about to go through the list again before we move on.
You already went?
Do you need a minute, Chris? Huh?
Can I get like a minute? Nope.
Sure.
All right,
Sure.
thank you. Thank you.
Take a minute.
Put the time clock on it.
I signed up when I signed in, I put yes.
You want to testify?
Okay.
Okay.
Do we have new names?
Two names. We're gonna do virtual and then that.
Okay.
So when
Okay.
we do this, I'm relaxed.
We'll give Chris a minute.
And I gotta pull it up.
Still, Chris Zawacki and Alfredo, if they've joined us, I'm sorry, I can't see everybody around the table.
She's.
Thank you.
All right.
He's got to speak from the heart, man. Yeah. I speak from the heart, I go out.
Chris, you have the privilege whenever you're ready.
That's fine.
All right, I go up there. All right.
Would you like that? I just got my license thanks to trying to use my yeah, in 2018. Sister City tried this.
Happy Monday, guys.
Yes, happy
Monday.
Monday, yes.
Good morning.
It is a good day.
Oh, I got a whole 3 minutes. All right. You let me know, I guess, when. All right, so good morning, Cannabis Control Commission. Thank you for having this public comment period. As you guys, you guys are, or I know we're already familiar, but for the people who are in the audience who don't know me, my name is Chris Fevry, CEO and co-founder of Your Green Package and Drist Brands. We're a family-owned and operated cannabis logistics and distribution company. Also, majority women and minority-owned, and also social equity-owned as well. Now, we're also one of the only operators that are right now simultaneously operating as a marijuana courier, delivery operator, and third-party transporter. And so we've, while this is great and all, this is something that's been very unique to see from multiple different aspects of the industry. But when it comes to the marijuana courier, these delivery changes are absolutely critical for the survival of the delivery industry. I remember, Chairman Hoffman, when he was here, he said, we are the guinea pigs of delivery. Thankfully, we didn't die in the experiment. We've been close to it, but I think, now that we've seen the experiment, how it transpired since 2020,
It's now time that these regulations go forward and ultimately, help all delivery companies from couriers to operators and creating a more equitable set of delivery regulations. So, again, I hope all these changes move forward and, overall help all the delivery operators. Now, when it comes to transporters, transporters are kind of the forgotten child of the delivery industry. We always talk about the couriers, we always talk about the delivery operators, but transporters are really the lifeline of this industry. If third-party transporters, and without third-party transporters, literally some dispensaries would not have product on their shelves. Third-party transporters also support the delivery operators and delivering to them as well. And so it's very, very important that with these regulations that we're changing for the delivery companies, that we're also revolutionizing the transport regulations, because those are also, frequently overlooked. One thing I would want to propose is the digitization of manifests. We have in our office, totes of manifests. And it's something that, one, is not sustainable from, we're wasting lots of trees, but two, we just need to move to like all the industries when they come, you get the little thing that you sign digitally and everything's kosher. And so we want to make sure that those are also included in the regulations for the allowing of digital manifests. The second piece would be, right now in the regulations is written that third-party transporters need to need to set up separate compartments in their vehicle. And if you're an operator, you understand that the way Glorious packages products versus Curaleaf versus Holistic versus Rev Clings versus Trifecta Farms versus Fine Federal, all these operators put their products in different boxes. So it's impractical for a third-party transport to prepare separate compartments for every single different cultivator manufacturer in the entire industry, because you don't know how they're gonna. You can't control. There's no standardization in terms of how people package their boxes, so you can't practically separate boxes. And in normal industries, like if you look at Amazon truck, it's an open back truck that has that they organize the boxes themselves. And so we would just want that part slashed out and allow the third-party transporters the own ability to organize their boxes in their vehicle and not have to have a requirement that you have to have separate compartments, because it also makes outfitting these vehicles extremely difficult as well. And then the last piece is clear regulations around weighting. So right now, as you can imagine, there's 300 dispensaries in Massachusetts. Every single dispensary operates very differently. A lot of people operate well. Some people do not operate well. And what's not clear in the regulations is the requirement for third-party transporters to have to wait for, like if you're delivering 100 boxes, you sometimes have to wait for those 100 boxes to be counted and wait. And some people, some people count faster than others. So it could be a 30-minute process, or it could be a 2-hour and 30-minute process, which then prevents the third-party transporters from delivering the other packages in their vehicle. And also leads us to having higher costs as well. And so I would just want clear regulations to say, hey, because also even what's now happening is that people do drop and goes, where they drop it off, they sign a piece of paper, and just have that in the regulation and say, hey, like, we're not required to wait. We drop off the products. That's our role has been completed, and then we can move on. If there's any issues, they can contact the transporter and so on and so forth. But ultimately, those are the delivery regulations in terms of extending the exclusivity period. I think what's in the what you guys put in is 7 years, if I'm not mistaken. 5 years. Well, I hope it's as long as possible. If it's 5, 7, I think an extension is necessary, because again, you almost killed the guinea pig in the experiment. I think the guinea pigs needs time to recover, or really the delivery companies we just need time to recover from obviously the damage that was done by the 2-driver rule. But ultimately, to wrap it all up, I hope the CC implements these changes as soon as possible. It's been long overdue, and I think if these changes are implemented, it will ultimately help the entire industry flourish. So thank you.
Any questions? Go ahead, Commissioner.
Yeah, thank you, Chris. So you said your company you guys are functioning as a courier, operator, and third party.
Yeah, well, we have, it's the formal license name is Existing Marijuana Transporter Licensee.
Got you. Okay.
Yeah.
And I know the third party transporters, some of them have sort of built a membership or small coalition. I know they've been talking to us as well for a few now. Are you speaking for yourself?
I am speaking for myself, but I think they would be very happy with those changes as
Yeah.
well.
Are there any other third-party transporters here today? I don't think so.
I don't think so.
Right?
Yeah, the third-party transport, unlike the delivery companies, the third-party transporters don't,
Yeah,
like all the, like half the delivery licensees are here, like
Yeah.
most of the market's here, but the third-party transporter is a different
Yeah.
set.
they're out transporting.
Yeah, they're out transporting.
Yeah. Okay, I get it. All right, thank you so much. I just wanted to kind of understand that because I know that they've built somewhat of a coalition, and I think we've all now, Commissioner Stebbins, Commissioner Roy, sounds like you've also met with the third-party transporter, so we've all met with them, and we may, I think Commissioner Stebbins had said this in the past, but we may have to bring in the third-party transporters.
Yeah.
Because I know that there's a lot of stuff that we need to look at in that license. But yeah, so it may be a separate conversation. I know we had started having it a while back, but we should definitely circle back on it. So thank you.
No problem. Go ahead.
Thank you, Chris. So you have an existing ME with a delivery endorsement
Yes.
and you go B2B?
Yeah.
Okay. So that's the point I was trying to make to Ryan earlier. So that makes it, we want to make sure the playing field is level, and I see we have Mike Baker. Is it like, I'm open to going 2-to-1 for B2B for third party in the ME with the marijuana establishment with the delivery endorsement and for ITLs. I'm open to that.
Oh, you're open to.
I want to say that speaking just as one commissioner.
Okay.
Mike, Attorney Baker, acting DC, is that within this scope? Is the B2B that, so anything delivery is within scope, correct?
Are you talking about for this regulatory round?
Yes.
It is within the scope, but we might have to talk about process with the Secretary of State's regulatory requirements.
Can you,
So we might have to do another round of scoping if we amend these regulations substantially. So I just need to double check of whether we can do that while keeping this date and not causing any further delay of implementing the regulations.
Commissioner Stebbins?
Do you understand what I'm saying?
I do. So if we go further than 2-to-1,
I think that it would be okay because it is a small technical change.
2-to-1, 2-to-1
Mm-hmm.
Yeah, and
is
it's something that
okay.
we had considered before in the work groups.
Okay.
Attorney
So
Baker?
It's conceivable we can do 2-to-1 on B2B and ITL in this round.
Yeah, I'll double check on that.
Okay.
Yeah.
Thank you, Attorney.
Sure.
Yeah, I was gonna say, Commissioner.
Commissioner?
Yeah, I was gonna say, Attorney Baker, I know you're all the way in the back. It's hard to hear you, but there's 2 seats up here if you want to join us. It could be,
Yeah, I think it might be.
helpful, but also I just want to caution us and caution the industry, because I mean, we're saying what we're saying right now, but we want to definitely get a legal opinion. Because I think to the gentleman that was before you, Chris, in terms of moving the industry forward, we're obviously here to be helpful. So that could be an interesting edit.
Hmm.
Thank you, Chris.
No problem. Thank you.
Thanks,
Thank
Chris.
you, Chris.
Right. As stated at the outset, what we will do, we'll take a quick break so we can get to the people who signed up to be with us virtually. And then when we come back, after the virtual testimony, we'll come back to the people who joined us today, who signed up today, and take care of those real quickly. So we'll take about a 10-minute recess. We'll come back at 11:20. You're on the list. I'm gonna put you, I think you were here ahead of Luca. All right. Thank you. Welcome back. We are still in the middle of our regulatory hearing. We're now about to hear from folks who asked to provide testimony at this hearing virtually. Welcome the folks that wanted to offer testimony remotely. I will go through the list. We'll see who's with us. And I would invite you to turn on your camera after I call your name. Again, we'll give you 3 minutes to provide your testimony. And as always, please use respectful language. The first person on my list is a William Whitaker. William with us? Okay. We'll move on to Chandra Batra. Right, not seeing Chandra with us. Oh, hi Chandra, how are you? Chandra, can you hear us okay? Good morning, Chandra, can you hear us okay? Chandra, can you hear us okay?
Yeah, can you hear me?
Yes, good morning. Chandra, there you are, good morning.
On behalf of small businesses and people in need of micro licensing in the state of Massachusetts, as well as changes to the delivery. I think that in this right now, we have so many dispensaries falling apart, and we have so many people who've overinvested and have invested from the outside through venture capitalist groups, as well as big market national groups and groups looking to go national. We need to bear in mind that those of us who started the movement started it for small businesses and to make money as small entrepreneurs, and that small entrepreneurship needs to be encouraged in Canada and Massachusetts. Unfortunately, we right now have a system of winner take all in this cannabis industry. And right now in New York, you can pay $7,000 and go get a micro license. I expect the same to happen in Massachusetts, that there will be an entry point for smaller operators to get into the cannabis business. I also like to propose that cannabis events be able to use micro license, be able to take advantage of cannabis micro licensing, and that would include the cannabis cafes and clubs. And thank you so much for your time.
Thank you, Chandra, very much for joining us. Greatly appreciate it. Any questions for Chandra? Okay, Commissioner.
I just want to make sure I understand you. So you're in support of the proposed changes for micro businesses?
Yes, I'm in support of changes for my businesses to be allowed in the state and to also include events as well as cannabis cafes into the micro business process.
Thank you.
Thank you, Chandra.
Consumption into the business process.
Thank you, Chandra. Appreciate it. The next person on our list is Francesco Ladies. Hopefully I have that pronunciation right. Yep. Chandra, you're still with us. You're welcome to stay listening in, or you can turn off your camera. All right, is Francesca with us? No. Okay, we'll move on to David Cometto. No sign that David has joined us yet as well. Ryan Cohen. I'm getting word that Ryan is not dialed in as well. Jeremiah McKinnon. I fully expect Jeremiah is with us. Good morning, Jeremiah.
Thank you all for the opportunity to speak today on behalf of patients who are driving force behind these regulatory changes to telehealth. I want to make 2 points clear from the outset. Is that first, Massachusetts Patient Advocacy Alliance fully supports access to telehealth for both initial and renewal visits. Second is that while the proposed draft language claims to offer patients a choice, the real choice before the commission is between the simple, clear path that has served us well for years and the newly introduced language that complicates and confuses the process. For 4.5 years, the telehealth waivers have been a lifeline for thousands of patients across Massachusetts, allowing them to access the medical marijuana program with dignity and respect. And in those 4 years, do you know what we've seen? We've had no negative incidents, no harm, just patients getting the care that they need safely and effectively. So the status quo, the waivers have made telehealth during an initial visit equally available to the patient as in-person care. But yet the current draft preserves significant contradictions by keeping the requirement for an in-person visit while also allowing patients to request telehealth. This habit both ways language creates confusion by making the in-person visit both a requirement and an option. This is not giving patients real choice. What would be more straightforward for the commission to amend the language to ensure that telehealth is genuinely an option rather than straddling the fence between 2 formats. This also raises serious questions about the complications for providers. Several cannabis clinicians post-COVID operate exclusively in a remote capacity. So it raises the question, if a patient does not request telehealth for their initial visit due to ignorance or their preference, what is the obligation of the provider that does not have the capability to conduct an in-person clinical visit? And then there's the addition of the term face-to-face. Let's be real, telehealth by definition is remote. Face-to-face traditionally refers to in-person encounters. So applying this term to initial telehealth visits creates confusion. And synchronous telehealth, real-time interaction through audio or video, has been working. It is modern healthcare and it has been successful for over 4 years. What patients need in the regulations is clarity and not unnecessary language. And we're not just talking about words on a page. The exact words we use have real impact on patients whose lives depend on this essential medicine. And the idea that telehealth needs to be restricted is an outdated and unsupported concept. So I urge the commission to slow down and really take the time to make the changes to telehealth properly, because we can't afford to introduce confusion or limitations where they're not necessary. So please trust the experience of the last 4 years and importantly, the patients who rely on this program every day. And the truth is, while we're embracing telehealth and granting certified nurse practitioners to authorized to certified patients, there are straightforward solutions these are straightforward solutions that should have been implemented a long time ago. There are real challenges to our medical program that patients face, and dispensaries are closing their doors. Hundreds of recreational dispensaries are operating freely. Patients are having to pay taxes because there are no medical dispensaries in their area and the system doesn't support their needs properly. The vertical integration requirement continues. Capital requirements of $500,000 to apply for a medical license. And these barriers to entry persist without any meaningful discussion from the commission. We have to confront these changes head on and not be distracted by surface level changes when the core problems really demand our attention. And we'll make sure to send additional comment in writing.
Thanks, Jeremiah. Commissioners, any questions?
Thank you.
Okay. Thank you, Jeremiah. Appreciate it.
Thank you, Jeremiah. Thank you.
That was all the folks that had signed up to participate remotely. Any of those folks jump back in and join us? William Whitaker, Francesco, David Cometto, or Ryan Cohen? Okay. All right. We will resume with in-person testimony here. And these are for folks who did not register in advance, but we're grateful that they're with us this morning. I'm going to go in the order. I think I saw them come into the room. So I'll start with Kim Gibson. Morning.
Yes. Thank you for your time. Kim Gibson from Gibby's Garden, the first licensed microbusiness in Massachusetts. Press submit spring of 2018, got our provisional in November and our final in June of 2019. So been in this a long time. For just a brief, those that aren't really knowledgeable, a microbusiness allows for 5,000 square feet of canopy and a manufacturing component, allowing us 2,000 pounds to purchase to work in our production in a year. The limitation that this new regulation is addressing is that if your name is on a microbusiness license, it cannot be on any other license. And that has been a bit of a change for us. So obviously we support these regulation changes. First and foremost, it will allow us to grow more canopy. With the costs of product these days, both retail and wholesale, we just plain need more product to sell. We consider ourselves a craft cannabis, a quality cannabis. And so I know that if we can grow more, we'll sell more and be successful. This also allows us to, if we chose to, or if a microbusiness chose to, get into a retail and be a tiered business, which is an ideal thing. I'm not at all interested in getting into retail, but I know that others are. What I would be potentially interested is a partnership with a retail dispensary or two that doesn't have a cultivation. And we could do a deeper relationship, perhaps in a shared, license type thing that we couldn't do before, where we would grow their desired strains for them. I think I'm excited about this. I think that there are dispensaries who want to get into cultivation so they can do this, but we have a cultivation, they have a dispensary. I think it lends itself to that option. So I appreciate that this is moving forward 100% in support of it. Just quickly, the one driver, yes. And as far as B2B goes, with the 5K cap on that one driver, there isn't going to be a ton of opportunity there if that cap remains. So if we find, I don't want anything to interrupt this moving forward. So if to change that 5,000 cap or change to B&B, altered it, then I would say hold off. And if this is successful, that should be part of the next thing, is drop that 5K cap. I want to 100% support digital manifests. Please. We're holding on to our visitors logs for 3 years. Anything that can go digital is a good idea. What are the other notes from other people talking? I guess that's pretty much it, unless you have questions. I wish that Deb was still here. I loved her comments, and I always tell people, call us. Find the dispensaries that offer that quality you're looking for. Find the ones that value the personal therapy that cannabis brings to a medical patient, and offering that higher terp, that variety of THC cannabinoids, specifically targeting the cannabinoids that the medical people are looking for. You've got to find them. And unfortunately, it may not be in your neighborhood, but the more that they're supported, the more that others will start selling them.
Thank you. Any questions?
Thank you, Kim, for your testimony today. Your business is in my backyard, literally just a couple of miles down the road. And I've had the opportunity to tour not only your facility, but other micro businesses that sadly haven't been able to weather the storm and have had to wind down operations. So having those tours really help inform me. And Commissioner Stebbins and I worked on the micro business piece because I've never heard of an instance where you'd have to put yourself out of business to grow your business, right? So that just didn't make sense. So thank you for that testimony. I also want to thank you for your work with veterans and the different studies that you've done with Dr. McNabb and iCount to help our veterans. And we as a board agree we need to do more to reduce barriers to access for our veterans. And also at some point, love to hear testimony around sustainability. I know you've done a lot of work around sustainability. And I know folks have talked to us about the plastic. There's so much, this is a very plastic heavy industry, whether it's the metric tags or the patient cards or the agent registration card. So at some point, whether, you know, obviously not this round, but future rounds of regulatory changes, love to hear more around sustainability. And I know badging is on the forefront of our minds. We hear it everywhere we go. So thank you for all your work around that as well.
Thank you.
Appreciate it. Dave O'Brien.
Thank you and good morning. My name is David O'Brien. I'm a founder and president and CEO of the Massachusetts Cannabis Business Association, the longest serving trade association in Massachusetts. I applaud your efforts on this latest round of regulations and changes. I'm hoping this is something that will give us some momentum toward other changes that are needed in the industry. Commissioner Roy was just speaking of something that seemed to be such a common sense approach to this. So we in industry approach this, that if there are changes that can be made that have no sacrifice to public health or public safety, we hope you're going to be all ears. And as you know, there's some legislative hearings coming up this fall that we've been invited to testify at. I'd love to speak with you, each of you individually offline about that. We're going to survey the industry and ask them what they want to see changed. I think, speaking frankly from the industry's perspective, I think they feel like they go to the legislature because they're not getting the answers fast enough from the commission. And I'd like to work with you to make sure that whatever comes out of the legislature is something that's workable for the agency. One of the things I want to mention, back in 2021, I think it was with your previous commissioners, the original five, I call them. We had approached them about the exclusivity period for delivery licenses. And at the time, there was a storm brewing from our competitor organization who was opposed to it. We came out in favor of it. And some of our members have spoken here today, Chris and Devin. And we are going to do that again. We want to extend the exclusivity period under the new rules for as long as it takes for these people to be profitable. To not give them that opportunity under the new rules would sort of be not doing them justice. I agree with what Commissioner Roy was saying on the B2B and testing labs. We stand up for the industry for having rules that apply to everybody equally. We don't want it to benefit a vertical company or an MSO. Most of our companies are not MSOs to begin with. So we just are grateful for that approach that you're taking to say what makes sense here. Have it apply equally to all license types. We're happy to see that you have this openness to just the changes that are necessary. We've evolved as an industry on the adult use side, and certainly evolved on the medical side since we've been doing this in Massachusetts. So we will continue to come to you individually and to opportunities like this to speak to you, to look for common sense changes that works for everyone. So thank you.
Thanks, Dave. Any questions?
Thank you, David. And, you know, just to reiterate, it sounds like your membership is in favor of the 2-to-1 for ITL and B2B.
Absolutely.
Okay.
Yeah. And it's an option. If some people want to use 2 or 3 people in the cab, go for it. But having it go to one driver makes everybody more profitable. And we don't think it's a loss to public health or public safety in any way.
Thanks.
Thank you.
Yeah, go ahead, Commissioner.
Dave, thank you, first of all. Any third-party transporters as part of your membership?
We have one.
Okay, all right, okay, all right. Just curious. I don't know if you've heard from them in terms of,
Yeah, I
The
mean.
two agents in a car.
again, They can keep two,
Mhm.
right? So you're not taking that away from them. You give them that option.
The option,
One,
yeah.
and it doesn't, testing labs in particular have said to me of late, like, why do we have to have two? drivers?
Right,
We're
right.
carrying so little.
Mm-hmm.
So.
Thank you.
Thanks, David. Lucas. There.
Good morning or afternoon. My name is Lucas Thayer. I'm the owner of Applegate Flowers LLC, perpetual provisional license holders, social equity applicant left behind. There's a lot more work to do for the social equity applicants. The exclusivity period for social equity for delivery operators and for social consumption lounges, which, by the way, where are those? Needs to be a 10-year exclusivity period, please. As we've heard from delivery operators that have been operating for the past several years, they're not profitable. The two-driver rule is having their profits undo the two-driver rule, please. But then beyond that, make it so that they can have that exclusivity for a meaningful amount of time. I've recommended 10 years in previous meetings. I'll echo that recommendation for a 10-year exclusivity period, please. In terms of social equity applicants and economic empowerment applicants getting priority review on applications, I believe that needs to extend beyond just the applications for provisional and final licenses, but also for a change of address, change of location application, packaging and labeling applications for pre-approval, a change of ownership application, provided that all of the owners are still within that social equity program or economic empowerment status. All of those other smaller applications that need to be done within the system, the Mass CIP portal, need to be given expedited review for those social equity operators, please. The social equity grant, I know you guys don't have direct control over what the grant money can be used for, but I think you might be able to influence a little bit. I think that grant money should be able to be used for property purchases for 4 tiers. If anyone qualifies for any of the 4 tiers of that grant money, they should be able to use it for real estate purchase, because the cost of rent is the driving force in what's killing all these businesses. People having to pay rent to landlords that kind of don't even really want to let cannabis happen in their facility anyway. We need to be able to buy our properties. And so there's all the grant money that's mandated by the state to be given to social equity applicants and economic empowerment applicants to help us into the industry and help us thrive in the industry. That grant money needs to be able to be used for land purchase in addition to development and staffing and professional service, et cetera. Okay, the driver, micro business licenses, they need to be able to expand their businesses if they are, like what the previous operator was saying. She can't go and get a larger business because she's bound by that micro business license type. I agree with the 2-driver for the transporters being reduced to 1. So someone who's transporting product, whether it's a few grams for the testing lab or 100 pounds for the dispensary, these cars aren't going to get robbed. We don't have highway bandits coming and stopping trucks on the road and stealing weed from trucks. So please do anything that you can to make it so that these operators can exist in the marketplace more effectively. Please, I see that my time is up and I'll respect your time. Thank you.
Any questions?
Any questions?
Awesome.
No, thank
All
you.
right. Thanks, Luca. Okay. Just to go back, we had some people whose names I called out who we hoped might be in the room. Maybe they've joined us. Chris Zawacki. Still missing Chris. Alfredo Johnson. Morning.
My name is Alfredo Johnson, and I would like to know, like, what's the real process to get into the cultivating business? And you guys have a financial for beginners, because I have no clue of, I just know how to grow it. I don't know how to
Okay. We would be happy to connect you with the right people on our team to learn about the license type in terms of financial resources. There is a fund available. It's available for social equity and economic empowerment applicants. But we'd be happy to, when the hearing's over, spend some time with you and connect you with the right people.
Appreciate it. Thank you.
And you might be eligible for a social equity program at some point, and that would avail you to learning business plans and some of the questions that you may have. So that technical assistance might be helpful to you, but someone from our EPCO team, and we'll make sure that we connect you with the right people to help answer all of those questions for you. Yeah, thank you.
Thanks for
If
joining.
I can, Alfredo, there's a lot of folks in the audience right now that are sitting here. If you don't know them, introduce yourself to them. They're already in business, network, connect, and I'm sure that folks who are here, the cannabis industry is one of the most collaborative businesses I've seen, right? Industry. So make sure you connect with a lot of folks who are there.
My name's Alfredo Johnson. I'm just trying to get in like.
There you go. Thank you, Alfredo.
Alfredo.
There you go. Welcome, Apple. Yes.
You have the official welcome apple.
Thank
you. All right.
Bob, come up here.
Yeah. Good job.
Good energy.
Is there anybody else in the room whose name I haven't called who would like to come up, introduce yourself, and have the opportunity to speak for 3 minutes? We weren't trying to single you out, but I was looking your direction. We're great.
Good morning, everybody. Thank you for the commission for holding this public hearings today. I really just wanted to come up here and discuss the 2-to-1 driver rule.
Can you say your name for us?
Yep, Gabriel Vieira.
Yep.
From Zipron. So yeah, I just wanted to come up here and discuss the inequities in the cannabis industry, specifically with delivery operators and courier. Really, it's to speak upon the 2-to-1 driver rule, the hour change reg, and specifically the exclusive period that I think needs to be extended to move forward with the injustices that have been taking place with delivery operators and couriers within this industry since the get-go. The focus will always be on those 3 things until they're finally enacted. I stand along my other colleagues within the industry, Chris Fabry, and a few others, Devin Alexander. But yeah, just wanted to make it known that these changes need to be enacted for us to become profitable. Would love to have more interactive meetings with the commission if we can get some time to put on the calendar specifically to discuss this exclusivity ruling, because that would make a world of a difference for us. Because once we all know with delivery operators and couriers, once that period is officially over, we're going to have a ton more competition and a lot of competition that has a lot more money than us to compete with us and potentially take us down. So we don't want to be put in that position. That was it. Thank you.
Any questions for Gabriel? Thanks, Gabriel. Appreciate it. Anyone else in the audience? Sorry, I can't see everybody around the poll, but if you haven't had a chance to speak, or you have had a chance to speak and want to come back up to the microphone to offer your thoughts and comments on anything that was said after you spoke, you're welcome to do that.
We've got the exclusive window. There we go.
Want to come back up, Chris?
I didn't think. Oh, yeah, okay.
Hi, guys.
Hi again.
Hi again. So the delivery companies would like to be on the website. Right now you can find a retailer, but there's no find a delivery option. So that would be a nice add. Also, the social equity program should be something that people can sign up for on a rolling basis. Right now you guys set up as periods, but say, like the good gentleman that was here, if he's not part of the program, he can't apply for any of the social equity grant funds. That's something that you guys have set up where it's on a, you guys do it in stages. And so that I think something that should be changed as well. And the exclusive period definitely should be extended. I think you've heard that from everyone today, but those are the only additional comments that I have.
Thanks, Chris.
Make one quick comment.
Of course you can. Come on back up.
David O'Brien with Mass CBA again. I'm gonna speak for Chris because he's hosted a regional roundtable at his place before. I'd love to convene all the delivery licensees to have this conversation as a regional roundtable and have as many of you as can come to it.
Okay.
Thank you.
Mhm.
Anybody else? Welcome to come back up. I know that we have listed this, I believe, till 4 o'clock. Obviously, we all know many of you have businesses to run. We certainly invite you to stay with us through 4 o'clock. I think what I'm going to suggest is we'll take a recess. We'll see if anybody else joins us or logs in virtually or shows up in person, then we can reconvene this group. But certainly want to thank all of you for joining us here this morning and offering your testimony. Just to give you a sense of next steps, our legal team is going over all the comments, looking at the red line version of regulations. We will be back meeting on this topic on October 22nd, where hopefully we can give our seal of approval to the final changes that, again, have to go through the final publication process. So, so thank you all for your time today. And you're welcome to stick around or you're welcome to go back to work. But thank you for being part of the conversation. Greatly appreciate it.
Thank you, Bruce.
We will be in recess until we see either people want to join us virtually or show up in person. Huh? Oh, we'll recess right now until 1 o'clock.
Yeah.
Thank you.
Well, that was, yeah, I mean, it's why I think, because they lost the Carolina, so they're
All right. All right, we are reconvening this regulatory hearing. I believe we have somebody who has signed up to offer testimony remotely. I'm wondering if Kevin Gilnack from Eon has been able to join us. Just a reminder, our rules of conduct, trying to keep everybody to 3 minutes. Obviously, we invite you to speak respectfully. But Kevin, thanks for reaching out and making yourself available today to offer some insight and testimony with respect to some of the regulatory changes the commission is considering. So,
Thank you, Chair, and thank you, Commissioners Smart and Ryan, for the opportunity to be heard. My name is Kevin Gillick, and I'm the co-chair for Equitable Opportunities Now. I also facilitate our Massachusetts Cannabis Equity Council. My first experience with cannabis policy was when I was arrested for simple possession by federal park police the day after I graduated college in Washington, D.C. Many years ago. So I want to thank the Biden-Harris administration for pardoning me and thousands of others. As a result of that arrest, I'm also enrolled in the upcoming cohort of the SCP. And I was first introduced into Massachusetts cannabis policy as the first executive director of the Commonwealth Dispensary Association during implementation of medical DPH and writing and passing question 4. Submitted detailed written testimony, so I just want to use my time to acknowledge this process and each of you and how hard you and your staff have worked to make these changes possible. I also want to give a big thank you and shout out to the Black Economic Council of Massachusetts for supporting EON and our advocacy, and most especially to the delivery operators who have organized and pushed for this for so long. I think it's important, especially after people going through a medical when there are different regulatory scheme, to acknowledge that regulatory changes are happening. The CCC is listening, and it takes a lot of work and a lot of intentionality. So thank you all for enabling this. I hope you make the most of this opportunity, if at all possible. In your scope, I think it's really important to do everything we can to support our delivery operators, including providing some predictability, extending the exclusivity period for no less than the duration between when it started and when these take effect, and committing to the stakeholder process that so many have spoken about for determining a long-term framework for ending exclusivity at some point. I also urge you to reduce reliance on the unregulated market by allowing delivery until midnight instead of 11 p.m. You had some robust discussion on that. I think it's really important to acknowledge where consumers are at and serve them instead of have them go to unregulated products and sources. So please consider increasing your flexibility there. Also, please consider unlocking tourism and small business opportunity by ending your prohibition on delivery to hotels, and increase patient and consumer access where it's needed most by ending your prohibition on delivery to no towns. I think there's a lot more we can do, but I think these all the changes we've discussed today are represent huge improvements for all these operators. And well, I haven't talked about it with the team. I just want to personally say that it makes a lot of sense to apply the same language to B2B transporters that we're looking at for consumer delivery operators. So I think that's a really important point that's been brought up. I want to echo those who have raised it. I also want to echo and thank Jeremiah McKinnon for the flags that he had on making sure we have precise language that protect and expand patient access, but express our general support for telehealth. So thank you very much for your time. I appreciate you hearing me out and everybody else today. And thank you again for all your hard work to get us here.
thanks, Kevin. Kevin, before you go, I offer the opportunity for my colleagues to ask any questions. Do you have any questions or comments for Kevin?
No, yeah, just quickly, will you be sending in comments?
We emailed them this morning.
Okay, I haven't checked my email. Thank you so much.
Kevin, in your comments, I looked over them briefly, your email. I didn't see anything on third-party transporters unless I just glanced at quick at one of our breaks. Can you reiterate what you just said about the third-party transporters?
I was just saying, it was news to me today, but many smart people that advise Eon raised that point, and I personally wanted to echo it, but our organization hasn't officially weighed in on it. So I was just offering that in my personal.
That you're in support of the 2-to-1? Okay. Thanks, Kevin.
Thank you very much for your time.
Thanks. You.
Appreciate it. Okay. Nobody else has joined us physically in our hearing room, and I think we've made every opportunity to reach out to the folks who had signed up to participate remotely. So William Whitaker, Francesco Ladies, David Cometto, and Ryan Cohen have not responded to us. Okay. Obviously, as a reminder, we are taking comments through the end of the day today. You can send those comments to commission@cccmass.com. We invite folks to weigh in on any of the regulatory topics or any topics in general. And that will give some time for our team to go through all the comments that we've received to date and bring back a final version of the regulations for us to give final approval to hopefully at our meeting on October 22nd. So what I would like to suggest is we just take a brief recess. Anybody have any thoughts? Till 3, we can see if anybody else has joined us. If not, we'll close the hearing at that point. Okay, all right.
And folks can give written testimony till the end of business today.
Yes, end of business today, 5 o'clock today, October 7th. So we will stand in recess until 3 p.m. and certainly we'll keep the doors to the hearing room open and anybody wants to join us, as well as, folks want to reach out and still want to offer testimony virtually, we can do that as well. We'll stand in recess until 3 p.m.
Okay.
Good afternoon. Welcome back. Reconvening this regulatory hearing at 3 o'clock. I believe we have one additional person who's signed up to speak remotely. I'd invite Raphael Richter. Raphael, how are you? You hear us okay? We can. Thanks for connecting with us this afternoon. Why don't you, again, just quick ground rules. You have 3 minutes. Encourage you to be respectful, as I'm sure you will be. And why don't you start off by introducing yourself, and then feel free to offer whatever comments you would like on our regulatory changes that we're considering.
You know, we're a third-party transporter that commenced operations in Massachusetts in 2020. Thank you for the opportunity to speak this afternoon. I have reviewed the hearing notice and did not see specifically third-party transporters being a topic that you are going to discuss, but it seems that it has come up over the course of the meeting, so I did want to use the opportunity while you're listening to those comments to offer some from myself and Eagle Eyes Transport. As I said, we've operated since 2020, and our experience has taught us that the requirement for 2 drivers for third-party transports is unnecessary from a safety standpoint, and it also raises the cost and operational challenges of transport and distribution services, which are quite integral to the success of the industry that we see today. You may hear from some folks in the third-party transporter space that safety is the reason for the 2-driver rule to remain in place. But we don't see any evidence of that in operations, nor do we believe that that's the case. We think that it may have to do with a perceived competitive advantage that third-party transporters may believe that they have in terms of requiring 2 drivers and the costs and training that go into it, and not necessarily due to the overall health of our space and industry. We'd ask that you make it optional for third-party transporters to use 1 driver instead of 2 with appropriate alternative security measures in place. At the very least, we would ask that 1 driver be allowed on transports that are directly from 1 marijuana establishment or a marijuana treatment center to another without any other planned stops, or for transports with a total value of $50,000 or less. I would just say that we are highly qualified to speak on this matter. We have transported thousands of shipments throughout the state for nearly 5 years now, and we have had exactly 0 safety incidents or occurrences of any kind that would require 2 drivers. We are aware of a media reported an incident that occurred as it relates to cash transportation with another provider around about a year ago. But we want to emphasize that that was a cash transport to a bank and had nothing to do with the standard cannabis transport, which again, I want to emphasize, for nearly 5 years and thousands of transports has not required 2 drivers on any of those transports as it relates to safety. So we would hope that you would consider in this change that third-party transports, again, are allowed to have the option to use 1 driver with appropriate alternative security measures. And I think that I've made the point clear, and I won't take any more of your time. Thank you so much.
Raphael, before you go, we always invite my colleagues to ask questions from your testimony. Commissioner Roy, I think you have a question.
Yes, thank
Go ahead.
you, Chair. Thank you, Raphael, for your testimony. You had said for us to consider the change that third-party transporters have the option to use 1 driver with alternative security measures in place. Can you explain what you mean by alternative security measures in place?
Yes, as you know, the commission has a process by which entities can request alternative safeguards. They go by slightly different names in my experience, like alternative safeguard or alternative security provision, in terms of how they're actually implemented by staff. But I would expect that you would just say third-party transporters just use one driver now without any other consideration for the regulations and why they were there. I would expect that should you grant this, an entity like ours that would want to use one driver would submit to the staff a plan for how one driver will maintain the same levels of safety and monitoring over the course of transports. An example could be that a live dispatcher needs to be monitoring the transport at all times on both video and multiple GPS speeds, and other things that might take the place of a second driver. Does that answer your question, Commissioner Roy?
It does. And I think what you mean is like updated SOPs reflective of that, right?
Correct. Yes, so I do want to emphasize that it's a kind of SOP, at least in my experience, but it's typically one in which it's allowing an entity to either do something slightly different as it relates to a security provision, or to actually sort of submit what that security provision would be. If that doesn't make sense, I would just say that there are various sections of the regulations that don't go into enough detail sometimes to actually actualize the SOP. An example could be the distribution and warehousing that transporters are allowed to do. There's not a lot of language about that, but it is through the alternative security provision process that we have more substance to those SOPs.
Thank you.
Certainly, no problems.
Yeah, Commissioner Camargo, hang on a second.
Thank you, Raphael. Can you just repeat the comment that you made around the 50,000 or less?
Yes, just as one informed, just as one person in the space, it felt that if you may feel uncomfortable saying one driver for every shipment, because there are sometimes high value shipments that may be over $50,000. The vast majority of cargo loads transporting cannabis are transporting cannabis with an overall value of 50,000 or less in terms of its wholesale value. And so that was, I figured you'd want some threshold where perhaps a second driver would be required because it is such an unusually high value. And that's a point that other transporters have made about safety. So I thought it might sort of toe a middle ground there.
Thank you.
And while I'm answering your question, I'll just say that the other type of shipment, maybe you don't want to put a dollar amount in or whatnot, but for a shipment that goes directly from one ME or MTC to another without any planned stops, there's also a much lower risk, nor is there the need for a second driver to be there for the unload and sort of maybe sitting in the car. Again, that process could be handled through the thorough alarm systems and such that are required on all the vehicles and never used because there's always a second driver in the car. But I would just point out that a direct shipment is pretty secure because there aren't any planned stops, and each facility that the cargo van is going to in that situation is a highly secure and monitored facility.
Thank you.
Good. Raphael, thanks very much for joining us. Appreciate it.
Raphael.
Yes, and then again, I certainly appreciate the extra time. So thank you so much.
No, that's why we're here. And if you have any other thoughts that come to mind, you can feel free to email those in by the end of the day.
Great. I'll email a summary of these comments to you shortly after I get off the line here.
Sounds great.
Great.
Thank you very much.
Thank
for your
you.
time.
Thank you.
Thank you so much, commissioners. Take care.
Thank you.
Have a good day.
Okay, so I have been alerted that we don't have I've been alerted we do not have anybody else who's waiting to testify virtually, even though we made efforts to reach out to all the folks who had signed up. Obviously, again, anybody who couldn't attend the meeting can still submit written testimony regarding delivery licenses, microbusiness licenses, and telehealth certifications for qualifying patients. Those regulatory amendments can be emailed to us at commission@cccmass.com by 5 p.m. today. And we will be back on October 22nd to consider all of those final changes. Our next meeting date is this Thursday for our monthly regular public meeting. If there's no other business, I will entertain a motion to adjourn.
So moved.
Motion made by Commissioner Roy, seconded by Commissioner Camargo. Any other comments or questions? Hearing none, all, roll call vote, Commissioner Camargo,
Thank you, and aye.
Commissioner Roy.
Aye.
And Commissioner Stebbins votes aye. We are adjourned. Thanks, everybody.